Welcome back. The Ministry of Health and Social Services is set to participate in a global campaign from the 6th to the 12th of November 2023 to create awareness around MedSafety Week. The campaign theme, Who Can Report, underscores the pivotal role that patients, community health workers, doctors, nurses and pharmacists play in reporting side effects and enhancing medication safety. Joining us to unpack is Frida Shiweda, who's a pharmacist in the Ministry of Health and Social Services. Frida, good evening and welcome.
Good evening. Thank you so much for having me.
Thank you so much for being here.
Yes.
As I just mentioned, this is a global campaign that the Ministry of Health will be participating in. So talk to us who are some of the ministry stakeholders that form part of this campaign, and of course what role they'll be playing.
Okay, so the Ministry of Health, basically Namibia, is a member state of the WHO, which is the World Health Organization. So through this hashtag MedSafety Week campaign, the ministry partakes along with national pharmacovigilance centers. These are medication safety centers, as well as national regulatory authorities worldwide, of which the Namibia Medicines Regulatory Council, which falls under the Ministry of Health, is then a member. So it's not only distinct to Namibia, it's a worldwide global campaign, and individuals as well as multiple stakeholders are taking part. They are part of the health fraternity as well as non-health sector. So the stakeholders can be anyone and everyone, because medication safety is everybody's job.
Yeah. And of course the Namibian campaign will be rolled out nationwide, and you've made sure that even people in the most remote areas are going to have access. Tell us about that and tell us how.
Okay, so initially when the hashtag MedSafety campaign was launched by the WHO through the Uppsala Monitoring Center, it was intended for it to be a social media campaign. However, for countries such as Namibia, where our geographic location is widespread and we've got facilities that do not have access to any digital platforms or so, we decided that it cannot only be social media wise, so therefore we also need to be able to take this material to the people in the communities that are destitute and that don't have access to these platforms. So what we have done is we've opened up the campaign to multiple stakeholders. We've also had information sessions where we basically capacitate the stakeholders as to how they can be involved, especially the multimedia stakeholders that have access to a lot of places in Namibia as well to help us. So the campaign material that is prepared by the Uppsala Monitoring Center is sent to us in the e-format, but we've got stakeholders who have offered to print the materials in hard copy for the facilities, specifically the state facilities countrywide, and they've already disseminated that, and we've got some more that we're printing this week as well. And part of this campaign is inclusivity, because we realized that a lot of the times when we didn't receive a lot of reports as a result of patients who have reported side effects that they've received or that they've experienced because of medication, it's because the information is only communicated in English and also only on social media. So this time, the posters that will be released and printed will be in 8 main local languages of Namibia, and we're very excited for that. So each day, as from tomorrow, we're going to be releasing 2 local languages each day. So, and we've also got multiple stakeholders who are sharing all this material on their social media platforms, calling us to the radio station. We've got the hospitals really going around in the wards from healthcare professional to healthcare professional, really re-emphasizing the importance for them as healthcare professionals to report, but also bringing in the patient, because you can't speak about medication safety without including the end user, who is the patient. So that's our grandmother in Usakos. Those are our grandchildren in Omedi and in the far parts of the country. So we're really excited. I don't know if you can tell, but I'm excited.
I can definitely tell.
Yes.
Tell us what this week-long campaign is seeking to address around MedSafety.
So we as a country are aiming to generate a lot of local data that will inform our local treatment guidelines for the medicine that is on the market for our patients. A lot of the times when policies and treatment guidelines are established, it's based off of international or outside data, and we can't really always rely on that to really inform how we are going to handle our patients and what kind of advice we're going to give them. If a doctor is going to be looking at assessing how a patient is reacting to a certain medicine, they can rely on foreign data, but the local data really speaks to how the patients are responding to treatment. The reason why this is because a lot of our patients do not report to the healthcare workers that they're taking other substances which are not necessarily conventional medicine. And if a patient comes to you and they tell you that, oh no, I'm only taking this blood pressure tablet, but then when they go home they drink another natural substance which is supposed to work the same, but then at the end of the day they end up reacting differently to the medicine. That's information that we don't have because we grow certain plants and roots that are distinct to our environment, right? So then we need to get our own local data to see how it can better cater for the people that we serve. So we're having also a much more holistic approach to the campaign, and also looking at global statistics, and even here locally, very regularly through the regulator office, we receive lots of complaints from the healthcare facilities and even in the communities of falsified and substandard medicines. So this monitoring of the safety of medicines through pharmacovigilance, through reporting, through encouraging patients to report, is one of the ways that we can combat this fight of counterfeit medicines, not only in Namibia but in Africa. Looking at the trade markets, how easily medicines can come through our ports, and maybe also the lack of control, maybe because of a lack of capacity in many ways than one. So this is a larger effort, really. It seems like it's just hashtag MedSafety, we make it look fun, but really at the end of the day it's hashtag medication safety and hashtag patient safety.
So what are the outcomes you wish to achieve through this campaign, Frida?
So number one, definitely having the public have a greater awareness of what to report, basically all side effects that you experience from a medication. Also where to report. So as the National Medicines Regulator, you can either call us on our telephone. We know that our campaign materials also have our contact number and email address. Also, we are able to just see exactly how far and wide the campaign has gone. So we don't only want responses to our posters that are in different languages in English. We want, if it's communicated in Damaranama, in Osherero, in Oshiwambo, we want the elderly people and the people who don't speak the other languages to do so. And the aim is also, like I said, inclusivity. So this year we're not able to cater for the other communities, such as the blind or the deaf. Exactly. So this year we really want to make noise in that aspect. The special treat of it is now the different languages, and then next year we're going to see how much broader can we make it. So, but ultimately it's also for us to get more reports. Report.
Well, fantastic. Thank you so much for being here, Frida, and all the best with the campaign. Thank you for your time.
Thank you so much.
That was Frida Shuela, pharmacist from the Ministry of Health and Social Services, speaking to us there about the hashtag MedSafety Week campaign that will be taking place from November 6 to 12. We'll be right back after this. Stay